Heart transplant was done in South Africa, and 3 days later they did a heart transplant in Brooklyn, New York. Both of those transplants were illegal and immoral. So the question was, how do they make it become legal? So they appointed a committee at Harvard University. Right from the very beginning, it was to make brain death become acceptable as death. Before the conference was finished, in the publication of the conference, they said we had to find a way to make this legal. In 1967, they did the heart transplants. In 1968, they appointed a committee. It was the desire to get beating hearts for transplantation that caused brain death to be invented, concocted, conjured, which means to make it legal.
What kind of a death is it that it's different all over the world?
Death is really not different all over the world. What is different are the words that make the criteria for death revolve around absence of brain functioning. Laws throughout the world revolve around an absence of the functioning or of the function or of the functions. There's only one country that uses destruction in the law. No country in the world other than the one uses destruction. So they observe an absence of some functioning of the brain, then do some test that actually makes the patient get worse. And from that, they declare that someone is brain dead. And that does vary from really in our country. Oftentimes it varies from doctor to doctor. It varies from hospital to hospital, from city to city. It's what's acceptable to do the next thing, which then is to kill the patient. They kill them by the test that they do, or they kill them by cutting out the beating heart. The donor becomes truly dead in the process that's done.
Is the partial brain death also possible in the USA?
I would say that yes, it is possible. What can occur is that, like in Great Britain, if they don't do brainwave testing, they have no way to evaluate the cortex, the largest part of the brain. And so, yes, it is possible. They really don't test for all the functions. Functions of the largest part of the brain, the cortex, and then the next largest part, the cerebellum, are impossible to evaluate in the unconscious patient without other kinds of testing. No matter what it is, it's not true death, because always they have a beating heart, they have blood pressure, they have movements, and if the donor is cut on without being paralyzed, they move and squirm. If they paralyze them without giving an anesthetic and they cut on them, there continues to be the response of an increase in heart rate and increase in blood pressure in all the patients. As soon as they cut, it's immediate, and it's immediate. It's a reaction that's very similar to what the anesthesiologist sees commonly in the operating room if the anesthetic becomes light, and then he knows he has to give more anesthetic. Not only are the lay people not informed, neither are the physicians, nor the attorneys, nor the legislators. They are not informed. Even the neurologists that participate, as recent as just a year ago, there's no consensus as to which criteria they use or the like. No, people are not informed. That's a very serious matter. Donors, potential donors need to be informed. The potential recipients need to be informed. The general public needs to be informed. But there is no way to inform them.
And there's no discussion in the media?
No, there's no discussion. The thing that has occurred in the media in recent months are some of the cases that I showed in the presentation yesterday. Ray and Zach Dunlap and Mrs. Taylor. Those cases are in the news, and they are informing the public but that's all there is. And then once those cases are done and out of the immediate news, you never hear about them again. They're gone. And so the general public's not informed. Not only the general public not informed, the doctors are not informed. The last time that I was able to present anything about this was in 2000. Since that time, I'm not allowed to present. I write articles. They will not print my articles in their journals. If you cannot educate the doctors, you cannot educate the lay people. The thing about the wrong diagnosis is that most of the time, the wrong diagnosis is found out after the patient is truly dead. My testimony was such that the patient wasn't truly dead when they came in the hospital, but in the course of that, they did something that made the patient become dead. One of the conclusions that I have come to in recent months is the method that they now use to get organs. And they no longer wait for an absence of all the functions. In fact, the matter is they admit that they have a functioning brain, but they still want to get their organs. And so they get a do not resuscitate order. And then they stop the life support. And then they don't wait till the patient is truly dead. They wait till there's an absence of the pulse. The recent cases that were reported in August were two babies from Colorado. They got a do not resuscitate order, turned off the life support, and waited for 75 seconds without a pulse. And that was the signal to cut the beating heart out of those babies. Brain death is only one part of the whole thing. It's really a culture of death in which we live. And the culture of death revolves around killing in one form or another. And it really, the modern culture of death began with the desire to get beating hearts for transplantation. And then all of the other things that we see in the culture of death came from that. The first heart transplants were in 1967, and then it became legal in 68. Or the killing that's done to make the diagnosis of brain death, or the killing that's done to get organs for transplantation. It's all killing. It's all taking a person's life. And we ought not do that as a society. We ought to protect and preserve the life of ourselves and of other people. And then, not only do I say protect and preserve the life, but now that I know what's happening in this issue of brain death and organ transplants, we must defend the life of the unconscious patient because they are vulnerable. That the laws are such that it makes it so there is presumed consent, and that's the law in many European countries. And presumed consent makes everyone a slave. It's slavery. And then to cut out their organs is cannibalization. To cut out the organs is to cannibalize the organs. And people need to be informed. You need to tell them that to become an organ donor is to become a slave. To have your organs cut out, it's to allow someone to cannibalize you. To sign an organ donor card is to give permission to the transplant surgeon to kill you. And you should not, you and your readers and your viewers should not participate in any of that.